That's something we're focused on particularly here. We're excited about some of the developments. We're excited about the University of Texas and Tyler, new medical school starting. We're excited with the West School of Nursing here at SFA that we produced. Kelly, I should have asked you, because we have a video, an intro video to this. Okay.
Keep going, keep going.
Okay, so, again, healthcare is something that matters to everybody. Sooner or later, they're all gonna need a good doctor like Dr. Head back there. So we're gonna need that access to healthcare, but it's a challenge, particularly, in rural Texas, how do we do that? And so we've got a tremendous panel here with us today, and a moderator with us. I'll introduce our moderator last, but I will take the liberty, and honor of introducing my colleagues in the legislature. Senator Kelly Hancock is here with us today. Came over from Fort Worth. I've known Kelly for a long time. He's what we call house trained in the Senate. He's been in the House, and but then moved over to the Green Carpet in the Senate. He's done a fantastic job representing his district and the entire state on many, many issues. He's currently served as the chair of the Senate Veteran Affairs Committee, also served with the Health and Human Services Committee. This is an issue of passion, I know, and his service is about access to health care for all Texans. He championed healthcare legislation, eliminating surplus medical for the 5 million plus Texans and state-regulated health plans. Graduate from Baylor, he's an entrepreneur, has a family business there, has done very well, allowed him to engage in his application on get that $600 a month. I don't know why you need to get but he has been there working with the state of Texas. Great guy. Hancock's are proud grandparents for 5 90 Texans. You got to get your bunch of work.
We're actually 6 now. There was a little child that abandoned basically at the hospital in August. With the 5-month-old took on, and so Emily is some adoption process in a month. So they've been conservative tours of Emmy for she went through some issues at the hospital and then home for the minute.
Is my old law partner and our now district court judge Jefferson D. Davis would say, "Sangles in the ground." So, with Senator Hancock, thank you for being here with us on this. Next to you, we're coming down the line. We do make an effort along the legislative summit to invite, to make this a bipartisan event. We're fortunate that Senator West is joining us this morning with family emergency. The Christians, Democrat, down from the southeast Texas area, and the Jefferson County, Beaumont area. I first met him as a staffer. So there's folks, the senator's house trained, he's staffed. There's a number of folks, I guess it's okay, because he's been around and seen all the scuffles and the things that happen, and decided he wanted to do it himself. So he's come back as one of the youngest members of the legislature. He's done a fantastic job. We've worked on a number of things together. A very capable, competent member from his district, and we're proud to have him here with us. One thing I'll say about the Democrats, I'm not picking on, but they're pretty bad about, Robert backed me up on this, they're pretty bad about no-showing. You give them, they called it the day before. So Christian, Bengals in your crown too. So,
that's because we're from Southeast Texas, which is God's country. Everything else is ridiculous.
God's country's a little to the north.
We'll talk about that on Sunday after I talk about
How about we East Texas is God's country, we'll leave it at that. Of course, we're going to move to the other side of the state. A fellow West Texan, of course, and Stan, thank you again for serving on the education panel. Stan Lambert is here with us from the Abilene area. Recently was successful in his primary. Will be joining the legislature in the next session. And it's done a wonderful job. Stan has experience, we talked earlier about education on the school board and chairman of the board of trustees of Abilene ISD, but also has been very active with Hendricks, which is now the only hospital they combine Abilene and so he's very acutely aware of what's going on in a town like Abilene, but also these rural counties on either side, the effect that has, and the challenges we're facing on how to provide access to people for health care where you don't have to drive 50 miles, 100 miles. I think, down south in southeast Texas, I think Harris County is the largest county in Texas without a hospital. And we're seeing throughout rural Texas where hospitals are closing, where there are situations that occur where you're going to have to drive 30 minutes or an hour, or if you need an ambulance, they won't be there for an hour to get you and take you somewhere. Judy and I had a child with arterial bleeding. At that time, Center, Texas, where we lived, had a hospital. They don't now. And that happened when we lived there. Our son very likely would not have survived. But we were able to get there because of that hospital center. So this is literally a life and death conversation we're having. These three gentlemen here are exceptional in their knowledge of it, so they'll bring many things to it. And then our moderator today, Kevin Lambert, we had him last night. He'll be moderating our panel. He's the program officer for the TLL Temple Foundation. Anybody who lives in East Texas knows the Temple Foundation and the tremendous work they've done after Mr. Temple funded that, founded that, with great people in charge, making decisions that have affected generations and generations to come in East Texas with the philanthropy of the foundation. But before that, he's a Chief Master Sergeant retired, 30 years in the Air Force. Thank you for your service, Kevin. And did a lot of things, but towards the end of his career, really stepped into some very high-profile, important roles with the Air Force. He's the senior advisor to the Air Force's Surgeon General, worked on several different panels focusing on our veterans and the care that they receive. And so it brings a wealth of experience to that, both currently with the DLL Foundation and their work for our region, but also coming from the military. So Kevin, thank you very much for being our moderator. Come up here and let these boys have it. All right.
Thank you so, let me just move that down. You know, it's a great thing. I learned a long time ago when you're giving a talk and giving a speech, one of the things you want to make sure you do is you look at your notes that you put on the podium before you got to the podium. Because there's always that guy that takes your stuff and rearranges it for you. Get started here. Hey, thanks. People ask me, what do I do every day? And I say, I give money away. And who would not want to have that job, right? It's a great job to have. But, you know, also one of the things that we say at the foundation is that, you know, thriving Texans are great Texans, and this state is a thriving state, and it is absolutely leading the way in our nation. And so thank you to all of you today for joining us on this great panel. I get the great opportunity today to moderate this panel about healthcare. So thank you to the Chamber of Commerce, to Dr. Head, to Kelly, to Donna, to everybody that put this great event on. We can't thank you enough. Hey, the NFL season is over, by the way. Anybody sad about that? I know a lot of people are sad because, and I'm checking my phone here real quick because I just need to make sure that I get the latest Taylor Swift notification. Okay, and so, you know, healthcare, I said, let me get some headlines about healthcare so that I can kind of lead this panel on what the leading things are on healthcare. So I went out to Fox News, and here was the headline. Woman sings Taylor Swift song during brain surgery. She's even debating on healthcare today. That headline about Taylor Swift was above the headline that said, a husband's mission to cure cancer. And so we know how important Taylor is to everything in our nation now. Absolutely. But I do have a dad joke for you. Everybody like dad jokes? Yeah. So a man, he calls the hospital and he talks to the physician. He says, listen, doc, he says, my wife is in labor and she's having contractions every 2 minutes. By the way, the Texas legislature, if you've watched that, if you go out to C-SPAN and watch that, healthcare communication and the communication on the floor sometimes is just like this conversation. The dad says, doc, my wife is in labor. She's having contractions every 2 minutes. The doctor replies, well, sir, is this her first child? And the man says, no, you idiot, this is her husband.
But I'm bummed.
Listen, we've got a great panel. We've got some great questions that we want to head right into here today. And so the first thing that I want to talk about first is absolutely what I said was there was some great work that was done in the last legislative session around healthcare. So thank you to everyone involved in that. And it just takes a big effort for that. But there's still some work to be done in healthcare. And an area where we hear a lot about lately is the status of mental health care delivery. In Texas, that seems to be a little bit of a problem for us. Mental health care delivery is very complicated. It has many components. And today we'd like to hear from the panel what you feel is the area that most needs attention in the healthcare delivery system in our great state. I'll start with you, Senator Hancock.
The entire system, it's really hard to come down to one thing because it's changed so much, and it's such an equity-based system now, and not that it's equitable, it's just that equity firms have recognized that it's growing at twice the rate of, frankly, every other sector of the economy, and they've launched into it, and there's so little market participation in it anymore. And so we've had to address some things where typically the patients get put in the middle of it. And so, and then the trend for Texas, I mean, one of the trends we've seen over the years, as I've chaired business and commerce for a number of years, was the continued reduction in closures and inability to maintain financial stability of our rural hospitals. And so the state's invested in that. The rural areas of Texas are so vitally important to us. We have invested in that area. But the whole, it's even hard to call healthcare a market. It is not a market anymore. There's negotiation between fewer and fewer players as we have consolidation come up. And in some areas, in many areas in growing, there's absolutely no competition whatsoever. That it is, I'm a free market guy, and I don't know how you deal with healthcare in a free market because it is so not at this point. And so we've kind of got to change our mindset from a government standpoint, recognizing this is not a market. You know, this is a very controlled, frankly, a lot by equity firms at this point. And the competition continues to be reduced, which means, frankly, those customers, patients, continue to have not just fewer options, but it's less and less competitive and fewer opportunities. There's no such thing as shopping. And so I think as a government, those of us that are free market principled guys really have to change our mindset, because it's just not that anymore. And until we do something at the federal level, it does change the way the state has to look at healthcare. And we've tried to step in, I mean, to address where we see that happen specifically in rural Texas. I don't really like it, healthcare, just because I'm a business guy. It's not a business. I mean, it's not a business anymore. It's a financial investment for large firms. Sorry. Don't mean to start depressing you.
Great setup for the next part.
I would say for me, I always look at it from, I would say, a community-based area. And I think most people in here, especially people who are in rural areas or suburban rural areas, kind of like my areas, we don't have anywhere to go. And it ends up being a county jail, it ends up being a police station, and then it somehow becomes this hodgepodge of right and left, and really and truly it should be a community effort. And one thing I'm really happy about is we're gonna have a behavioral health center where we're gonna be able to kind of lessen that on our police office and our sheriff's office. And and I think also just kind of getting rid of that stigma. Having this conversation, I think, is really important for people to understand. Mental health is important. Some people struggle with it, but it shouldn't also be an excuse to say, oh, I'm dealing with this, I can do whatever I want. Everybody just needs to put the bill for it. Some people need mental health help, but it doesn't need to be something that's long-term, and also letting people understand you have to be able to stay on your medicine. And being a free market person, but also just being a Texan, I think we all pride ourselves on getting in there, getting the work done, and sticking with it. Otherwise, we wouldn't be a state. And we kind of have to get to that point, I think, where we're changing the culture and understand it's okay, you know, it's like diabetes, you gotta take care of yourself, you have to do this. But we're not putting everything on the taxpayer, but also making sure taxpayers are getting what they're actually paying for. And finding ways to help people that once they're there and they're more stable, to be able to stay there and also just help everyone else out at the same time. And that's difficult because it does cost money, but at the same time, I think if we take care of mental health and we are getting people on track, it allows us to be able to, how can I put it? It allows us to move forward where we're not exacerbating the problem, where we're having people who are self-medicating, and then that way it kind of stabilizes, I think, everything. But it always makes it that much more harder for people in rural areas, because if you only have enough space for one place, it could still take you an hour to 2 hours. And someone going through a mental health crisis, they need something or someone that's familiar to them, and if not, sometimes that can send them spiraling. And I think it's a complicated issue, but I think we're taking a lot of steps forward to recognizing those things, and that's really important. I think once we get over that hurdle, it's going to stabilize itself in a better way. Looking at it from a human issue, rather than just looking at it as a financial issue, as my grandmother would say, she's a tall woman. Paul says if they don't work, they don't eat, but don't forget your brother. So I think we take care of them, but they have to want to do the work, and people who are saying, I want to be able to do that and help my family member, we're also saying, this is the resources that you can do, just by saying, go to this counselor, you already have insurance, you can go do things like that, and just kind of that community.
You heard the term financial incentive, you heard cost of doing business. So, you know, resources, obviously, something that I think the state began in 2017 is when we really kind of started addressing some of the resource deficiency, and Representative Forprice, at least in the House, was kind of leading that effort. Senator Hancock was doing so on the other side of the building, the pink granite building. I'm a retired banker, kind of like Senator Hancock. You know, healthcare to me is, when do I get my next shot? What's my, you know, why do I have a headache today, doc? But I'm, as a retired banker and a former athletic director, I mean, you probably say, I know you probably met a banker and you say, well, there's a mental health issue right there. But I like to look at it kind of from the standpoint of, in the rural areas, beds. We don't have enough, and the growing problems associated with mental health issues have outpaced and totally surpassed what our state had anticipated. We're pretty good at predicting where our next road construction needs to be, you know, where we need to build some more schools, but we kind of missed the boat, I think, in terms of thinking further down the road, maybe 15, 20 years ago, about what kind of mental health issues would be challenging our state. Representative Manuel kind of touched on the issue of, you know, sometimes they end up in our ER rooms, our emergency rooms, sometimes they end up, you know, in our county jail. One thing that we did, and I just want to point this out because I know we have limited time, but in Abilene, about 4 years ago, we established a crisis response team. So now we have, when a 911 call comes in, instead of that call just going to a local law enforcement person, you know, one of our police officers that's out on the street to address that, we send this crisis response team, which is a law enforcement, a policeman, as well as a fireman or firewoman, whatever, and then we also have a social worker who has training in the field of mental health, and so they go and address the issue, whether it was domestic abuse or just, you know, a problem. Maybe a law was being broken, but it wasn't a terrible crime. And they assess the situation, and the purpose of that is to alleviate having a police officer having to take that person to the emergency room, for the medical community to try to evaluate, try to determine, is this a physical issue, a physical problem, or does this need to be addressed more in our behavioral hospital? We have one behavioral hospital there in Abilene, and so instead of that one policeman spending 8 to 10 hours with that particular victim or that person that made the call, or somebody made the call on his behalf or her behalf, they have been able to really become a lot more efficient in not crowding our county jail, not crowding our emergency room, which are already crowded, and having to sit there and wait 5 or 6 hours just to see a doctor. So you know, that's an approach that has worked in terms of some of the mental health in our rural area. It has allowed us to become much more efficient, and it was provided from a grant program that I would probably have to make some phone calls to find out exactly the name of it for you, but I would if that's something you're interested in. So You know, my issue, and I guess my greatest concern though is the mental health issues that are addressing our children and our students. And I know that local ISDs are, if money is available, are trying to hire more social workers to work in some of our middle schools, junior highs, and high schools to try to help identify problems that are maybe just at the very beginning, and maybe we can get them some help, even though we don't have just a preponderance of mental health professionals, psychiatrists, psychologists in Taylor County, Texas, but we can certainly hook them up with Texas Tech University, who has a great program for telehealth in terms of dealing with some of these psychiatric and emotional problems that some of our students are dealing with. So there is some movement, there is some work going on in our local public schools to address that.
Yeah, and that vein, especially with our kids, recently was able to review a study at a meeting where our kids no longer, they don't go to the principal or the teacher or the coach when they have issues of self-esteem or do I fit in? Anybody want to guess the majority, the main place they go to when they feel that they're in that position? TikTok, exactly right. So rather than going to, they don't trust adults anymore, and so the largest place that they go, the highest percentage, around 45% of the times they'll go to TikTok when they're having basically mental issues, the beginning of mental issues. And so I think as a state, we have to recognize what's changing and change the way we're doing things, which is, trust me, for someone who's had to deal with CPS on a child left at the hospital, government does not like changing, and they're almost adversarial to those that are trying to help in this situation. So we've got to change the way we address the mental health of our students, because they're changing where they're going to for advice.
For business people, y'all know a lot about healthcare. Awesome, thank you so very much. Well, I want to shift a little bit the conversation this morning. In the last panel did a great job of talking about the importance of the workforce, the development of that workforce, and what that looks like today. Certainly the healthcare workforce has had its issues. And so according to a recent Texas Hospital Association white paper, a staggering 64% of Texas hospitals are operating with fewer beds and reduced services due to significant nurse staffing shortages. This has been sounding familiar for a long time. This has a critical impact on communities and patients, as these shortages will limit specialized care, reduce service lines, create emergency room boarding, increase transfers, impede hospitals from accepting transfers, and then eventually further exacerbating burnout. What innovative solutions do you see to solve this problem in Texas, and what other health workforce solutions do we need to pay attention to in this next legislative session?
So we've...
You're ready to go, so I'm not.
Well, we've been moving in that direction, and so we've been very intentional. You've got to fill the pipeline, and so specifically with the nursing. In fact, Wednesday, today's Friday, right? Wednesday I was at the #1 military medical facility in San Antonio, visiting with them on some of these issues and all the wonderful things they have going there. Yesterday I was in El Paso at the Texas Tech medical facility, talking specifically about nursing. I'm doing that. So I think we're addressing that, but they're in the pipeline still. And so we got to continue to do that, and we're going to do that all the way up through. And it is one of the things that we have transitioned in our educational system, and specifically higher ed, that started in our tech schools, like TSTC, that there's incentives now, formula funding through higher ed, to address needs within the economy, and when you do that, you get additional state funding. And so this is an area that we're seeing higher ed continue to focus on nursing specifically. It's one of the things that if you go visit any of our medical schools, you're going to hear about nursing, because the state did make this an emphasis probably 6 years ago, maybe 4, I've been serving too long, and so we're starting to see that. So I do think we'll get there. It's just, you can't change overnight. But I do think we're progressing in that direction, and our higher ed institutions are very much aware of it, and they will constantly be talking about nursing, and the number of those enrolling in their nursing schools are increasing. So we should see that improve significantly. And I was saying, not being involved in healthcare, I've learned a lot about healthcare. I went through a kidney transplant, July of 2022, and I'll take meds the rest of my life, so I get to experience all kinds of healthcare issues. Like the letter I got the other day telling me they're not gonna, they no longer cover my immunosuppressants, which it's not like they want me to take a generic, which Greg Bonnet and I address step therapy, so they can't do that. Because I can't just switch on doing that. I'm pretty much stuck there. So yeah, a lot, we all deal with healthcare in different ways. And so it's been, I have had a unique side of looking at it the last couple of years.
I'm just gonna give, I'm gonna be a little personal, just give a shout out to Southeast Texas, because we have one of the #1 nursing programs in the country, and we are getting our nurses out there and getting them everywhere else, and just kind of echoing. I think that's a problem that the solution is being answered, and we're just waiting to see the full effects of what's gonna come out that way. And it's, for me, it's really beautiful, because it's something for people to be proud of, like, hey, we are actually getting everything together for the rest of the country, the rest of the state, to be able to prosper and be able to be healthy and not have people try to take them off the medicines that they need, and be able to do that. And that, for me, is a really good thing. I guess I always correlate it to the cake is still baking, and then we gotta, rise, and we can put a little frosting after it's cooled down. But I think, like they're saying, we're getting there. And I know legislators aren't always supposed to say this, but I think sometimes we often forget that we fix problems after they have become so exacerbated. And so when we actually are able to fix them, it takes a while to see those effects. But I'm not gonna say I think. We are going to be seeing that change happening very soon. And I'm very proud of Southeast Texas for being a part of that.
I took some notes because, as I said, I'm a retired banker, but last session, we made strides through the Professional Nursing Shortage Reduction Program, the Nurse Faculty Loan Repayment Program, Graduate Medical Education, Physician Loan Repayment Program, Family Practice Residency Program, and the Rural Residency Physician Grant Program. So, as Senator Hancock said, I think we are making some progress, and yet, like you said, it doesn't happen overnight. So, a lot of healthcare providers and institutions are trying to think outside the box, which I congratulate and commend them for doing that. In my area of the state, the largest medical hospital is Hancock Medical Center. They are now in negotiations and in the process of bringing over from, and I apologize, I don't remember the exact name, which country it is, but there are nurses working in Mozambique, or there's some African country that have, we think, and they've done a lot of research on making sure that they have correct educational, correct credentials, but they're gonna bring them around 150 to 200 nurses, and they could hire 1,000 nurses today if we had the workforce, if we had the applications. That's how behind we are in terms of being able to serve. And Hendrick is a regional provider. I mean, they do attract transfers, and they bring people in from within 75 to 100 miles of Abilene. But they are about to bring in these nurses that are making X amount of money in their home country, and yet can come to the United States and probably double or triple the amount of salary and income that they're going to be able to make. And they may only stay 2 or 3 years, but it may just be a short-term solution until this pipeline really kicks in and provides some of our college graduates and the ones that are making that transition into having some experience besides the educational credentials. But that's just one answer to kind of a problem that we've dealt with. I know that during COVID and with all of the issues involving COVID, you know, visiting nurses and so forth, and retention and hiring new nurses was a problem. And so I know that, you know, hospitals are under a tremendous amount of stress and trying to create the revenue generated, but, you know, revenue is kind of in these boxes of, you know, Medicaid reimbursement, and private pay, or, you know, insurance, private insurance and so forth. So you've got certain limitations about how much you can grow revenue, and yet, after COVID, I think I was told that they had to adjust their budget just for 1 month, about $11 million, and their margins went from 2% down to 1%, as far as their net. So, you know, they're struggling, they're under a lot of stress, in the rural areas to try to, make sure that we have beds available, that we have the workforce available to serve, which we do not have, and that we can pay them a competitive salary in order to bring them here. So thinking outside the box, I think is important in these times, and I encourage everyone to look for ways to try to kind of bridge this gap.
Well, I want to say to that point, you know, a lot of times, people are a little bit hesitant that we bring, maybe people that don't look like us in to provide healthcare and other things. And one of the things that we always said on the battlefield is that, I really don't care what uniform the person is that's over me, that's treating me that day. I was an Air Force guy, but I don't care if it's a Navy or an Army, you know, a soldier or a sailor that's giving me the care. As long as I'm getting the world-class care, I don't really care. So we really appreciate that. And in last session, the House and the Senate did a great job of addressing that. One of the things that Senator West did was he introduced a bill about mental health loan repayment. We talked about mental health at the beginning. There was a parity between provider loan repayment programs and mental health loan repayment programs to the tune of almost $20 million annually in the budget. And so we were losing mental health loan providers because of that loan repayment program. And you all did a fantastic job. I think you increased it by almost $15 million. So really kudos to you all for doing great work on that. Shifting a little bit again to another subject that I think is going to really hit home here in Nacogdoches, especially at the events that happened here recently. But only 40% of rural hospitals in Texas today deliver babies. Only 40%. Most of Texas is a maternity desert, with moms driving sometimes up to 2 hours to deliver in what we call a safe environment. We used to say there's no place for moms to have a baby, but we know that those moms are having babies. They're just not having them in the labor and delivery unit. What can be done to reverse this trend of closing labor and delivery units in Texas? And by doing so, we decrease the maternal morbidity and mortality rates of moms in our great state. Representative Manuel,
I think that's a kind of well, I guess everything healthcare related will be complicated, but I think it's interesting because just women in general, but particularly Black and brown women, are starting to go back to doulas. And I know some people feel that it's controversial. But
Not just Black and brown, my
Right.
oldest, same,
Well,
I mean,
well,
yeah.
we have the word maternal mortality rate bill that's represented theory she's been championing, and it's just statistically Black women are dying more in hospitals, so a lot of them are going to doing births. And I don't necessarily see where it's a bad thing if you're working with your doctor and other healthcare providers, and they're like, you can totally do this, you can do it at home. I always say this seriously, jokingly. My grandmother is my best friend. She's 94 years old, and she was born in the living room. And she's proud of it. She's like, no, I was born here in this house that my dad said he paid $1,500 for, and he was so nervous because he was like, I had never bought something that much in my whole life. I didn't even know if I was gonna be able to pay it off. It's like $1,500. She went back and asked me about like 20 of those houses. They bought the whole block. But I think that we also have to make sure that we're protecting rural hospitals. I just think it's vitally important. I'm just gonna give an example from my area. The one thing I'd love to ask people is, what do you wanna see change? Because I think a lot of times people say when they want change, with healthcare, with the area. Everyone says, you know, we want a nicer downtown, or we want to liven it up a little bit, but they still want the same culture. And I think we can attract doctors by, you know, sprucing up certain areas like our area, getting people to come out there. And I'm just thinking of an idea of getting doctors and nurses so that we have hospitals, is giving incentives to rural areas. I don't think there's anything wrong with helping everybody. I'm not saying the cities don't need help. I'm not saying rural areas are the only ones that need help, but a rising tide lifts all ships. And I think if we were to really look at that and ask the cities to tighten up their belts a little bit, because we are literally hanging on in some places, that's a good thing. Because if you're a woman and you're going into labor, you don't know if that's gonna be at 10 o'clock when everybody's at work, so you can just get to the hospital, or if you're gonna be coming from somewhere in Orange, Texas, and all of a sudden it's 4:30 and everybody's getting off work, and then there's a traffic jam, and you're sitting in traffic for an hour and a half going on the labor, and then they have to send a helicopter, which costs more money. And I think there's a lot of innovative ways that we can do it. I think that is letting some people have at-home births, making sure that they have everything that they need, and also as well as making sure rural areas are getting the help that they need. And I know it may seem weirdness because it always comes back to taxes. That's when we get incentives, it does come down to taxes. But I think we can do it in a proper way, and I think we can do it in a human way. But we have to be open to ideas, but also not forcing people to feel as though you're gonna completely change what their economy is like. And I don't mean by, as in how people look, it's just changing everything so much that people are like, I thought that was a Wendy's there. They're like, no, it's now this, because, you know, they say the 18-year-olds want to have this special kind of coffee place. And you're like, but they don't even have jobs to go buy it there. So why would you put it there? It doesn't even make sense, you know. Change is not good, but if it's change towards help the community grow, put more revenue in there, help those hospitals. I think that also helps with people who are choosing that verse at home or feeling as though they can't live in their area because they might not be able to have a safe birth. I think, you know, you just need to really be thinking out of the box, and sometimes the craziest ideas actually are the sanest ideas. So that's just kind of how I look at it.
I think telemedicine and technology will continue to maybe broaden the scope of possibilities in terms of just normal, day-to-day type of regular healthcare. I think incentivizing and trying to get general practice physicians to maybe move into a rural community and just practice as a general practice, but possibly with low-risk pregnancies and deliveries, maybe even general practitioners could possibly even take on that assignment to provide that delivery if it's a low-risk type situation. Obviously, your larger hospitals are going to be more equipped, have more support staff, and be better trained to have, you know, in difficult pregnancies or complicated delivery processes. But I think we've got to continue to expand, and I know Representative Ashby's probably going to talk about broadband in the next session, so I don't want to jump into that, but I do think that we've got to make sure that our rural communities have the accessibility to be able to communicate and talk to the specialization of physicians and nurses in the larger hospitals, larger communities. But a lot can be done in some of those, what are now happening in my district, are the hospitals are closing, but they're reopening as medical clinics. The triage units are basically more just the initial impact of an injury or some trauma, just to get them stabilized as best they can and then transfer into a regional larger hospital like Abilene or San Angelo or Lubbock or Wichita Falls. So just anything we can do, I think, to broaden our scope. And I'm not talking about nurses doing the job of doctors. I'm not trying to take the responsibility away from doctors and their years and years of medical training and so forth and their education. But I am saying that I think there are some basic types of healthcare that I do think that we can open the door a little bit more to expanded opportunities, and as long as we've got good broadband and good telemedicine, accessibility, when there's a problem, if they can get somebody to work through that problem, so, I think that, yeah.
But I do think regulation, you're aware of how long it took us to get telemedicine. And so it is a financially viable industry. And they don't want to change in that industry because it's already a financially viable industry growing at twice the rate of, everything else. Which makes all this change very hard. And so, from our perspective, we kind of need the help because a lot of where we are today is driven by the demographics that we saw coming 10 years ago, but frankly, we just didn't think of everything. And so, demographics are driving this. Rural communities, the younger people are moving to urban, suburban areas. Then they realize yuck, and they do something else. And so the demographics were there. Frankly, we just didn't catch it soon enough, which it's hard to catch everything. And so that's where why we're not supposed to be in session for 10 months, because it is important for us to get in the community. It is important for us to shop and eat and converse with the people that elected us, because they're going to be thinking about things that we're the 8th largest economy in the world, and we have a lot going on. And I'm a 2.75 student in college. I'm not going to think of everything.
I was on the dean's of the list as well. I was on the dean's list.
No, lots of smart ones. So I think that's why we were designed the way we were designed in Texas, is we're supposed to be with y'all. And then for a short period of time, we can go and represent you with the issues that we learned from you in Austin, not live our lives in Austin. And so, we needed hospitals in other areas, and it's why we're a representative republic, where we represent our districts with all different things, because I would not know this. Because I'm not going to go to dinner or church with a rural general practitioner that can tell me, from a rural area, that can tell me what's going on. But the demographics told us, and we just didn't catch it, and now we're seeing it, and we are going to have to address it. But frankly, any change within the medical community, I would say it's like pulling teeth, but you can pull a lot of teeth before you get change in the medical arena, and we're going to have to change and adapt to the demographics and the needs that these demographic changes are creating. And I will tell you, legislatively, it is a very protected industry from a regulatory standpoint, due to legislation that we passed that was right at some point, and right changes. And that's kind of where we are in our rural communities. And it's going to, trust me, it will be a real hard fight. But we've got to make some changes to provide that access. And, I think it is. Doulas or whatever, because why my daughters would do that, couldn't tell you. Didn't think it looked like a fun idea to me, but they had their children, and they're very healthy. But we're gonna have to change the way we do healthcare in order to meet some of these concerns that we're seeing, that the demographics told us, this is coming, you better get prepared for it, and it's just hard to make change in healthcare.
Well, I will tell you a really quick funny story. One of my staffers, she was doing, her second child was a doula birth. And she was going into labor, and she was like, okay, I'm ready, I'm in the water already. And then they turned around and her son had jumped in it. And she said, and now we have to go to the hospital. The best laid plans in my city.
I don't know how much that would have made on America's Funniest Video.
Especially as she was going into labor and trying to get him out because he was ready to swim and play in the pool.
Well, it's great comments for sure, and Senator Hancock, I think you said at the beginning, this whole equity issue, right? Payment and equity issues are huge to overcome. But I have to again give kudos to our legislators in this last session. We did make some headway on this issue around community health workers, and some legislation that you did pass to actually authorize reimbursement for community health workers in that prenatal space to help that out. And so a lot of people will use CHWs and doulas in kind of that synonymous term, but we know there's a little bit of difference in that. And so, you know, enabling moms to have their babies in a safe environment is very important to the health of the community. But having a labor and delivery unit in your hospital, in your community, is also viable from an economic standpoint. I'm looking at Eddie Hopkins over there, and I'm thinking, okay, if Eddie's looking to bring in Toyota in Jasper, and they're gonna bring in 500 employees, with 300 of them being of birthing age, they're gonna want a place for their employees to have babies in a safe environment. And they're not gonna choose Jasper if they can't do that. So it has an economic standpoint to it as well, as a safety standpoint. So how are you, I think we're right at time.
I think we're right where we need to
Right at
be.
time.
Stop
Well, let's
sign.
just give a great round of applause to our director.
Kevin, thank you, panelists. Y'all stay close, I think we'll photo here a little bit. We are right on schedule. We are not going to have our speaker from the Texas Transportation Commissioner, today. He has some travel conflicts and wasn't able to make it. That's the good news, these reasons are far ahead of schedule. Senator, we're gonna move, at 11 o'clock, so let's everybody take a break. Come back in at 11 o'clock. We'll go to the next section, which is build it and they will come. Future impact of infrastructure and investment in Texas, led by Senator Nichols, with a great panel there as well. So thank y'all for being back here about 10 minutes.
All right, now I can go home.